I'm Nathan Giede
And I'm Aaron Eckman.
from BC's northern capital.
Welcome to the Ram and Stag Show.
Hello and welcome to Ram and Stag. Today we're going to be talking about Bonnie Henry's provincial health order, and this dates back to April 6th, but nobody's talking about it. It's been a busy month for me. Our little girl arrived at the very end of March, so sorry that I've been incognito, but we're happy and she's healthy. In any case, Bonnie Henry, not so much. She's still suffering under the debilitating illness of thinking that COVID-19 holds any relevancy whatsoever in today's world after we've all been infected with it or have already been forced to be vaccinated against it. And of course, that vaccine has expired within the veins of those who have taken it because they're only good for about 6 months at a time. And the last time more than 90% or 99% or whomever's left in our healthcare system, I can never keep count anymore, took a vaccine, I believe the number one was behind a two in this third decade of the 2000s, of the new millennium. In other words, I believe it's been since 2021 that anybody has bothered to get a vaccine. In any case, here is the release from the BC Government News, Provincial Health Officers Minister's statement on end of respiratory season. That's what we refer to winter now as. It's respiratory season, spring COVID-19 boosters. So summer is fire season and winter is respiratory season. We'll figure out what spring and fall are soon enough. Dr. Bonnie Henry, BC's provincial health officer, and Adrian Dix, Minister for Health, have issued the following statement on the end of the respiratory season and spring COVID-19 vaccine boosters. If somebody says respiratory season one more time. Anyways, the COVID-19 pandemic has been a challenging time for everyone, and the people of British Columbia have shown incredible resilience and dedication in their efforts to combat the virus. People stopped caring about this 2 years ago. From the beginning of the pandemic, British Columbians have understood the need to put and keep in place measures to protect our communities and healthcare system. This was particularly important as we weathered the respiratory season over this past fall and winter with the combined effects of COVID-19 and influenza, as well as other viruses like RSV, which all strained our healthcare system. Yes, that's called an immunity deficiency. So because nobody was exposed in 2020 and 2021 due to lockdowns and some of 2022, the issue becomes that the common cold becomes more severe because you haven't had it in a while, right? If you're used to something debilitating or something kind of nasty, and then you don't have it for a really long time, it'll hit you like a real whack-a-mole when you get it again. That's basic science. We used to understand that. It's basic medicine. At this time, we have seen a decrease in all respiratory viruses, which allows us to move forward with confidence in removing some of the measures that were in place. It's the end of flu season. Congratulations. This is a positive development that reflects the efforts of everyone in our community in the following guidelines and taking precautions to keep each other safe. It's important to recognize that COVID-19 is still with us, and as such, we must remain vigilant and continue surveillance to monitor the situation. I never thought I'd see the word surveillance used by a healthcare authority in a positive light, but here we are. It truly is the 2020s. As we approach the next respiratory season, I thought it was summer, we will be prepared to consider measures that may be necessary to ensure the safe functioning of our healthcare system, including potentially reinstating some of the current measures. So don't get too comfy. We're going to bring it all back next season, next flu season. Okay. Not news to me. Are we going to get to the news at some point? Here we go. Beginning this week, the spring booster vaccine program is available to provide a boost of immunity for people at the highest risk of severe illness or hospitalization, including those over 80 or immunocompromised. Okay, we're going to stop right there for a second. They just admitted that the only people who need to be vaccinated are immunocompromised or very elderly. That's a statement now from the BC government and the health authority and Bonnie Henry and Adrian Dix and the whole shebang. That's it. That's the statement. That's the smoking gun. We've been operating under 3 years of fear. 3 years of absolute terror and terrorism, for that matter, outright tyranny. People were locked in their homes. People were prevented from going anywhere. People could not go to the pub. People had to produce a vaccine passport inside their country of birth and residence, for which they already hold a actual passport or the right to one. They just admitted that that was all completely unnecessary because it turns out the only people who need to be vaccinated are those who are most, I don't know, they're that highest at risk for severe illness or hospitalization, including those over 80 or immunocompromised. Well, congratulations. The BC government now agrees with science that is as old as our entire understanding of virology, which I'm guessing dates back at least a century, perhaps a century and a half. All right, moving right along. The new booster will help to maintain and lengthen protection against severe outcomes of COVID-19, especially hospitalization and death. No vaccine can prevent death. That doesn't work. We don't have the eternal life elixir. That doesn't exist. It is important to note that individuals who have not yet been vaccinated are at higher risk of contracting and spreading infectious diseases and have a more severe illness with COVID-19. The issue at hand is we've all had at least touches of it, whether we didn't exhibit any symptoms or whether we had the worst flu we've ever had in our lives over the last 2-3 year period. Look back, think back to a really bad day of cold that you've had in the last 36 months. That was it. So if you've had that experience, or even if you've had a mild, but it still felt like severe in its mildness, it's like, man, this is a worse cold than I've had in a while. It's not like I'm not debilitated, but I'm like, this isn't good. You had it. You had it, or something related to it, or one of the variants. So you're carrying antibodies. Again, basic science. That's how this works. We have understood this since the Black Plague, and earlier for that matter. We didn't need people in white suits to tell us this stuff. We understood it intuitively for many, 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 many centuries, bordering on millennia, actually, if you want to go back to the Egyptians. So yes, if you're not vaccinated, I guess things could go bad for you, but the problem is they already went bad for you. You already had the illness, so you have the antibodies. So you're as vaccinated as anybody else. You just happen to not get forced to get a jab with a gun to your head. Okay, here we go. Further provincial health officer orders requiring healthcare system workers to be vaccinated. Okay, here's the meat of the system. All right, let's go back here. Further, provincial health officer orders requiring healthcare system workers to be vaccinated remain in place to protect patients and healthcare workers and ensure the resilience of the healthcare system. The past fall and winter have been challenging, and we want to acknowledge the incredible work done by the people of BC. We also recognize the exceptional strain on our healthcare system and the tireless work of our healthcare workers in providing access to care during this time. We thank everyone in British Columbia for continuing to roll up their sleeves, get vaccinated, and look out for each other. Together, we will continue to emerge from this pandemic stronger. Okay. You know why people have to work tirelessly, or rather they're not tirelessly, they're fatigued, they're beyond exhausted. It's because we have 7,000 people that aren't allowed to go back to work because we're still toying around with this stupid vaccine mandate for healthcare workers. Now, I want you to step back and think for a moment about what would happen if you eliminated anywhere in Canada. I don't care if anyone anywhere in Canada had 7,000 positions eliminated overnight. How that would go? How would that go? How would that go if there were 7,000 less gas station attendants? Yeah, there's probably lots of them. But guess what? If in one single jurisdiction, 7,000 of them stop being there, well, that's not going to work out so good, is it? You're going to have staff shortages. You're going to have overages. You're going to have overtime out the wazoo. You're going to have problems. You're going to have worker burnout. You're going to have people complaining. You're going to have a move to unionize the people of the gas station. That's going to be a big deal because people are going to be tired of these working conditions. We have participated in medical apartheid in British Columbia. It was disgusting. It was abhorrent. It was indefensible. And in the end, the science said it was completely unjustified. It didn't work. It didn't help. It didn't solve anything, but it definitely made some people angry and it cost a lot of people their jobs. And now that we're through the pandemic, now that you with your 10 boosters or me with no vaccine, whatever, wherever you are on the spectrum, now that we all have the same number of antibodies for COVID-19 and its various variants, and we just came through a terrible flu season because guess what? That's what happens when you lock people down and don't let them cough on each other and spread the disease around. That's how it works. That's how humanity has built up immunity to every disease ever that's communicable. Yeah, it turns out that none of that worked. None of the things we did to try and fix COVID-19 worked, and we're still holding on to the dregs of a failed policy where because you won't get the jab for a variety of reasons, perhaps conscience or perhaps the science, you understand basic rules of evidence and it doesn't work. It doesn't mean anything. You're not allowed to go to work. That's wrong. That's evil. That's totally arbitrary. And it really makes some of the tyrannies of the 20th century look like, child's play because you couldn't pull that off. Not even that long ago. And do you know why you couldn't pull it off that long ago? It's because that lesser educated group of people just a century ago understood some things intuitively that have been propagandized out of all of us now, right? Thanks to what we have, what we call our education system, and in general what we call our media. We all think that somehow things have to come from experts. Well, guess what? Even your milk doesn't come from an expert. Scientists figured out how to pasteurize it. Sure, they did. But in the end, you operate a machine and from a cow comes milk and it gets shipped out the door. And that's how it works. You trust an entire bevy of things and throughout your life. People have driver's licenses. Sure. You know what they don't have? They don't have tens of thousands of hours of experience when they get behind the wheel, especially if they've got an L and an N on the back. They're still in the graduated system. They've only had a few hundred hours at best. No, we don't trust experts for everything every day. All day. You trust people that have a kind of intuitive understanding of what they're doing to pass the test and get on with life because otherwise we'd all be stuck in the slow lane forever to even get a cheeseburger because apparently someone needs to be a chef in order to cook a cheeseburger. No, that's not sensible. And yeah, medicine can be complicated, but the basics of immunity and virology are clear. People communicate disease. Unfortunately, those who are most vulnerable do often fall to the disease. That's reality. That's life. That's how it is. And we develop an immunity, a resistance, and the rest of the population moves on. That's how it goes. And apparently, we all forgot about that for the last 3 years. And we're still clinging to it. And you know what this is? It's punitive. It's punitive. What it is that anybody in charge who knows that they got this wrong, who knows that that didn't work, the lockdowns didn't work, the vaccine didn't work, none of it worked. It did not cure the disease. And in fact, it made the entire fallout from COVID-19 worse and caused huge political disruption in this country, fundamentally undermined our trust in our institutions, in our politicians, in our leaders, and in our public health officers for that matter. No, this is punitive. This is punitive because 7,000 people, probably more, in British Columbia decided to act on their conscience or make a choice, or maybe they just didn't give a whoop. They just, you know what? I'm not doing this. You can't make me. Well, they don't want to concede that they had the upper hand. They had the moral high ground and they're still right. They don't want to concede it. They don't want to admit that they're wrong and the people who stood their ground were right. And we need to think about that. It's time to be honest with ourselves. Do we want our healthcare system to function better? Are we tired of seeing everybody with giant bags under their eyes at the ER, at the hospital, at your health clinic? Are you ready for people to come back to work? Are you ready for proper staffing? Or are we going to stay on our high horse of totally failed policies and the absolute colossal collateral damage they cause? Are we just going to stick with that and we're not going to admit what we need to change?